Hi, everyone. It's Dr. Jacqueline Cortez Salmon here at Transformation Health and Wellness in Anaheim Hills, California. I'm happy to see you. It's Wednesday, February 17th, 2021. And I had another topic planned, but somebody reached out to me today and asked that I speak about anxiety and how it affects us physically. And ironically, she was actually probably the fourth or fifth patient I've seen just since the weekend. So Saturday, Sunday, and so in 5 days, like 5 patients in 5 days, having really significant anxiety, not necessarily related to COVID, just in general. And so we're seeing this really big uptick in anxiety. And with a lot of doctors' offices being closed, a lot of precluding factors from having us have the ability to seek counseling in person and so forth, it becomes very, very difficult for folks to get appropriate guidance. So I'm hoping that I can kind of share some of that with you today. So anxiety is a very, very real condition that I think if you haven't ever experienced it, it's very difficult to understand. So a lot of times our knee-jerk reaction is to say like, oh, well, just think happy thoughts, like just stop worrying about stuff. It's going to be fine. But what we're not addressing really in kind of our lack of understanding on a deeper level is that if I wanted to control that anxiety, I would have already. So if it was that easy of just like think happy thoughts like Peter Pan, then we wouldn't be suffering from anxiety. So it's a very different part of our brain that gets utilized. So the think happy thoughts part is this very frontal portion of our brain. So the frontal cortex, the prefrontal cortex is the very deliberate planning side of our brain. So that's telling us like higher functioning, saying, I'm going to plan to do this for my calendar today. I'm, doing all of these activities. I want to think happy thoughts. I absolutely want to feel better. I do not want to have anxiety. I'm going to do this, right? So that is the frontal cortex. Where anxiety stems from is the very central part of our brain. It's really it's in the amygdala, hypothalamus, thalamus, this whole very central portion of our central amygdala that is in control of that center regarding anxiety. So that's what's kicking off all of these biochemical signals, has nothing to do with what we think, like here in that frontal portion, that planning and deliberate portion. So where it's coming from that very primal portion of our brain is basically this perceived threat. So it's that fight or flight response that gets signaled. So there's some sort of a perceived threat that our body is now signaling to the body, to the brain, everybody get out, get out, get out. There's a dinosaur, it's going to eat us. And so, we want to look at it from that very basic standpoint. And then that frontal part of our brain tells us how we can outthink said dinosaur, how we can outrun that dinosaur. But really the fundamental foundation of where it comes from is that central primal part of our brain. Now, when I say perceived threat, sometimes there is a provoking stimulus, right? We have a near miss car accident, boom, our anxiety goes up. We kind of stay shaken. Our body literally shakes. We start sweating. Our heart's racing. And so, again, that is a very real threat. It's something that our body perceives as predation or putting our body at risk of being in danger or dying, right? We're put on this earth so we can survive. So if there's anything that, is trying to prevent that from happening, our body is going to have this very physical response. Our cortisol level goes up, our sugar levels go up, insulin levels go up. So all of these physical things are happening, right? So that's an actual threat, right? What's frustrating about people who suffer from anxiety is there's not always necessarily a predisposing factor that triggers the anxiety, right? Again, it's very easy if I know like, oh gosh, hearing ambulance sirens reminds me of whatever, and it's very anxiety provoking. So now I can avoid listening to those things or doing those things that put me in that, in the way of having those triggers. But we don't always identify a trigger. And again, this is a biochemical pathway. There's actual chemistry that's being triggered and released, and all of these processes that are happening as a cascade or a ripple effect as a result of those biochemical signals. So there's not always a perceived threat. There's not always an actual predisposing factor that leads to these anxiety attacks or panic attacks. So getting back to some of the physical manifestations of it, definitely we can see that there's an increase, and it has been studied for years and years and years. Definitely increase in heart rate, increase in blood pressure. So what our body is doing is, again, it's trying to survive, right? So it wants to outthink and outrun the predator. Again, even in an anxiety situation where there's not an actual predator, there's no actual threat, our body is in this pathway of doing so, right? So what it's going to do is it's going to release a ton of cortisol. That cortisol goes to the liver and says, hey guys, we need sugar to feed the brain cells and to feed the large muscle groups. We vasoconstrict peripherally, right? So we get like cold, clammy hands and feet. And that's because it's not as important to have our hands functioning as it is for our larger muscle group. So we can like fight said predator, or we can outrun. So we want to get that blood flow to our quads. We want to get blood flow to the brain, right? So we can outthink and outsmart. Again, it's a theme, right? You're hearing me say this over and over again. But then physiologically, what is our body doing? Vasoconstricts, increases blood flow to the heart. So we're increasing our heart rate. We increase our respirations because we're trying to get more oxygen in so we can oxygenate the brain and those muscles. So it's all very methodical and physiologic that our body's function is all in place, and it's a very intact demonstration of how our body is designed to survive. Okay. So how do we walk this back then? So this is the problem. Again, if we don't have a predisposing trigger where we say, oh, okay, every time I do X, I have an anxiety attack or I have a panic attack, well, then we can just avoid X, right? It's that simple. But it's not that simple when we have this sort of tripped loop. We're sort of stuck on repeat with people who have anxiety or who suffer from panic attacks. And so it's inappropriate release of all of these biochemical pathways that sort of get in the way of us being able to heal and feel much better and not having these physical symptoms. Okay, so what can you do then? I oftentimes say that food is the most underutilized drug and exercise is the most underutilized antidepressant. Now we're talking about anxiety. Oftentimes we see depression and anxiety sort of on a continuum scale. So some people are like very like isolated, withdrawn, kind of crying in the corner. That's what we identify as depression. And then there's like claws out, stuck to the ceiling, cat with the hair sticking up. That's anxiety, right? Most of us, and I would say this is probably universal, most of us fall somewhere on that scale, right? There's not one of us out there who has never had an episode of depression where I felt down and sad, some life event or whatever, or we're very anxious and we're waiting for test results. There's something going on. We've all experienced this, right? But again, usually there's a predisposing trigger. So that being said, those of us who suffer from actual anxiety disorder are sort of on this end of the spectrum where we're sort of always with our claws out or very often with the claws out, the hair standing up on ends, very irritable, that mood lability where it comes in and out. We sort of overreact to things that should be a normal life stressor, like the mail coming on the first of the month, dishes being in the sink, things that should be very manageable are no longer manageable because of this hyper response, this hyper biochemical pathway that's happening. So as we're getting into hyper, what do we always think of as inflammatory cytokines being released. We know that when we have any type of anxiety provoking episode, like arguing with our spouse, things like this, then we actually have elevated levels of inflammatory cytokines such as IL-6 for like 3 days. So it's no joke, right? It's actually physically, we can measure these things in your bloodstream from these types of activities. So people who have high anxiety will typically also have high inflammation. And then that inflammation creates pain, it creates discomfort, it creates insomnia, and making the anxiety even worse, right? So it's this spiral that continues on, and it's difficult to break that cycle. But there are ways that we can do it. So coming back to, again, food being the most underutilized drug, exercise being the most underutilized antidepressant or anxiolytic, decrease your inflammatory food intake, right? This is huge, guys, because if you're going to be putting more inflammation into your body on a regular basis, you're going to experience more of those negative side effects. Now, whether that's joint pain, whether it's chronic fatigue, or anxiety, these are all manifestations of increased inflammation in our bodies. So cutting back, particularly on those processed sugars, dairy, gluten. If you got rid of those three, you really don't need a whole lot of additional like skin testing, food allergy testing. Now, sometimes you will, but by and large, I think the mass amount of the population, if we were to just cut out those three things, we would be so much better just in general, right? That being said, hydrate. Again, recurring theme on my planet, right? Given my recent episode in the hospital, hydrate, hydrate, hydrate. So making sure that you're drinking lots of water, because as we are producing those inflammatory cytokines, getting rid of them is really the key. When they stick around, they continue to do peripheral damage. So they keep having this collateral damage that goes on. So we want to get them flushed out of our system as quickly as possible. And a diet high in antioxidants will also help to remove those inflammatory cytokines, as well as those reactive oxidative species, or the ROS chemicals that are running around in our bodies. Another thing I kept notes over here: exercise. Exercise, exercise, exercise. I cannot emphasize enough. Exercise is huge in reducing anxiety and also in reducing depression. So this is critical. We have then a key release in epinephrine, norepinephrine, and those are kind of our feel-good hormones. They suppress pain, so we don't have as much pain. Again, when we have headaches and joint pains and that sort of thing, that will diminish when we have regular exercise. It helps with lowering our blood pressure. It helps lower our resting heart rate. So again, if you're starting from a lower inflammatory space, then if you do have a release of cytokines or a release of cortisol, then you're going up to here, as opposed to if you're already very inflamed and then you're going here. And so this is when your body gets out of control and it's difficult to kind of walk it back off that ledge. And so reducing that overall inflammation is critical. And so doing that with diet, exercise, and hydration, right? Just like our moms always taught us, these things are so, so critical. And maybe our moms didn't know why those things were true, but they're definitely true, and they show in the studies as well. Okay. Other things that you want to do is decrease stimulants. As hard as it is to do, right? I love my caffeine. I'm not going to sit here and lie to you that I live a perfect life by any means. But those stimulants actually do us more harm than good, because we get this lift and then crash. And then we're anxious about the crash, or we're fatigued during the day. We get brain fog. We're not thinking clearly. Again, those stimulants also increase cytokines. And so we want to kind of reduce putting things in our body that are just going to make our symptoms even worse. Those stimulants also will intrinsically raise our blood pressure, raise our heart rate. So again, we're not doing ourselves any favor if we already suffer from anxiety. Being here, putting a stimulant only makes it here. Nicotine is also a stimulant. So again, those of us who like to smoke a cigarette to relax, you're actually making that problem worse. It's the same as people who drink alcohol to calm their depression, when alcohol is a depressant. So you're actually doing the exact opposite of what you think you're doing with using those things as like medical relief, so to speak. So avoiding stimulants is key. And then some more proactive things. Trevor, I see you over there. So again, probiotics, something that is largely missed in the grander Western medical community, is the importance of that microbiome. There is a gut-brain axis that is huge, and it is very, very underrepresented in the education that we get in medical school, and just in the Western medical culture at large. But this is crucial, because if we're not having good microbiome, we don't have appropriate breakdown of our foods. We start to absorb things that are larger proteins that our body gets inflamed about. Here we are hearing this theme again about inflammation. And so that inflammation can manifest as anxiety. That inflammation can manifest as pain. So all of these things, it's so important to kind of restore that microbiome and ensure that our body is able to process foods appropriately, primarily tryptophan, right? So we always hear about tryptophan being in turkey and that sort of thing. There's plenty of foods that have it in it. It's not a sleep hormone. Now, tryptophan will convert to become melatonin, but more importantly, it converts to become serotonin, which is one of our primary mood stabilizing feel-good hormones. So if we do not have good gut health, we cannot absorb the precursors that are designed to then develop into the neurotransmitters, right, it's a lot of words, the neurotransmitters that help us with mood stabilization. So again, predisposing us from that diet standpoint and that microbiome standpoint to giving us anxiety because we're not feeding our body the right tools that it needs to function appropriately. So it's going to function inappropriately and it's going to be very loud about it. And then other things that you can do. So again, getting yourself on a good probiotic is key. And there's studies, like multiple studies going all the way back, I've found since the 1970s, as a matter of fact, showing how a restoration of the normal microbiome actually can really, really benefit psychological health. And then magnesium is critical. I love me some magnesium. I'm not even going to lie. It helps with anxiety. It helps with heart contractions, muscle contractions, nerve regeneration, insomnia, bowel issues. So it really is just a generally good mineral to be taking overall. And you want to find the right one for you. There's a whole topic, in and of itself of the different magnesiums that are out there and available, but very, very beneficial in helping to restore calm. Okay. And in fact, there's a magnesium supplement out there called Calm, just to make it uncomplicated for you. L-theanine also is a great adjunct to that magnesium, which I often prescribe through my compounding pharmacist, but I think it's also, so we can do the two together, but I think it's also available just over the counter, your vitamin section or what have you. If you need any help with deciding on which supplements to use, which probiotics to use, that sort of thing, by all means, give our office a call. I'm happy to walk it through with you. But just to let you know that education is power. So when you empower yourself by knowing what's going on in your body, why it's doing it, and then what things you can do proactively to help manage it, I think it gives you so much more power in your corner to be able to control what your body is doing. And that's really, really critical. So rather than going to your doctor and they're like, here's your Xanax, right? Which again can be a very useful medication. I have plenty of patients who utilize it on, the occasional basis. But we then fundamentally have to get back to why is your body secreting these biochemical pathways that it shouldn't be? Why is it sending out all of these signals that it's in danger when it's not? And how to lessen that is really the key. So hopefully this has been some help. Me and read our little comments here. Yes, and again, in Trevor's talking about doing that caffeine reset, which is so important. So again, weaning yourself off of that caffeine. Hopefully you don't have those withdrawal headaches, but getting some of those chemicals out of your system is so critical to maintaining good psychological mental health, which then also plays out into that physical realm. So I hope this helps. I hope you enjoyed it. Please comment below. Make sure you subscribe, turn on your notifications, all those things so that you can get notifications when we post a new video. But more to come soon. We'll talk with you later.